Great day to you and welcome to Flint Strong. This is our inaugural podcast here in the City of Flint, talking about the great news that we're doing each and every day here inside the City of Flint. You know, one of the things that we want to communicate to you, the viewer, is all the great things that we're doing inside the City of Flint so you can get and be a part of the great news inside the city. This week, we just passed the Gus Macker event. You know, another great event downtown Flint where we had hundreds of people participating in basketball on a 3-on-3 tournament. Young people from the ages of 8 and 9 years old to older people. One person we came across has been participating in the Gus Macker since 1979. Imagine that. Pro Kids was a shoe of that day in that era because I had a pair. Now it's Nike and Air Jordan. I don't have a pair. But definitely we're doing great things inside the City of Flint. You know, upcoming, here in the City of Flint, we still have the Crim Road Race and Back to the Bricks. You know, something that's a signature piece of downtown Flint. We want you to be a full part of the growth and the progress of our community. And one way that you can do that is to be engaged in some of these great and free activities that we have inside the City of Flint. We had a carnival over the 4th of July weekend. Fireworks illuminated the sky. Also on Juneteenth, the oldest African-American holiday in this country, from the emancipation in 1865, we celebrated that here in downtown Flint. And, you know, the holiday of Juneteenth became a holiday in the City of Flint before America recognized it as a full holiday. I was very proud to be a part of that, and all residents participated. Whether you're black, white, rich, or poor, we all engage in those types of celebrations in our downtown area. Downtown is growing. We have a lot of brick and mortar buildings and places in our downtown area that has been revitalized. We were able to produce grants for some of these buildings, Spuds, Wayne the Barber, 810 Nail Bar, and many, many more. We've been able to help get them a jump start. America needed that jump start after the COVID-19 epidemic across our country and our globe. We're here to be able to say that we support residents in this community. Just recently, the wildfires in Canada, it wreaked havoc on the Midwest. Air quality was very, very poor. Here, through the partnerships that we have created inside the City of Flint, we're able to give out air purifiers and masks to our residents, trying to increase the level of care for them during a very traumatic time for America, especially in the Midwest. We continue to do great things in that space. We want you to know about it and to be a part of those great things. Coming up this week, we have another great event coming up, recognizing two great Flint residents, also from the medical profession, Dr. Mona and also Dr. Raymond Giss. Dr. Raymond Giss was noted for being a dental person here, a dentist in this community, but also the first African-American recognized by the American Dental Association. He stood strong then, and he's standing strong now. We wanted to give him the highest honor that we ever could from the City of Flint. And Dr. Mona Atisha, noted from being famous for uncovering the lead crisis and now for RX Kids. These two great American citizens, two great patriots, help make Flint strong. And that's why we're here today to talk about these great things in our community. Upcoming, we have another segment for you, and I want to introduce you to some people in our new department. They're doing fantastic work, and they're going to be doing great work for you, the residents. So stay tuned.
The City of Flint's street maintenance crews are hard at work across the city. From Ballinger, Clio, Davison, and Stewart to many other roads throughout the city, please slow down and use extra caution in work zones to help keep our hardworking crews safe. With more than 500 miles of roads throughout the City of Flint, this important work takes time, but every mile completed is another investment in our community. Thank you for your patience as we are building Flint back, better and stronger.
Welcome back to Flint Strong. Today, we have a great broadcast because this is our first one, and we want to be able to introduce you to people that's making Flint stronger each and every day. But today with us, we got Sheba Ward, a Flint resident, a native of this community. We have great people and great things always coming from the city of Flint, but people are giving back each and every day. And one of those great people is Sheba Ward, and Sheba joins us, a daughter of a pastor, also motivated by different things and motivated by life. being motivated by certain things, it triggers us into action. I lost a brother. I've lost a sister. Though their time here was special, and I always recognize that. But also this person here has lost a brother, but also it sprung into action, a new motivation, a motivation to be able to engage others, to be able to help people feel special, be special during their time here. I want to welcome Sheba Ward to us. And Sheba, thank you so much for being a part of the Flint Strong and being a part of the Flint Strong team.
Thank you. I'm glad to be here.
And you're working now, you're in the health division of the City of Flint, running the health navigation office. You came by way of an interview process, and you came to working with the city. One of the things I like to say is, like, when I'm not involved in actually the hiring of a person, they do very well once they get here, right?
Yeah.
And you've been doing fabulous, and you're great and you're special. Tell us a little bit about that.
Thank you. Yes, you did tell me that. You said I'm not involved, but I'm appreciative because now you choose me. I'm a Flint resident, born and raised. I went to Roy Wilkins Accelerated School, K through 6, and then I went to Holmes Middle School. And then by way of choice, went to Hamady High School. I grew up in a two-parent home. My parents are amazing. My mom's a pastor, my dad's an elder. And I was able to see the dynamic of family, but also at an early age begin to understand the importance of family, health, and support. And that led me into my life as a young adult, as a teenager, and then as an adult woman. I went to the University of Michigan Flint for several years before moving to the West Coast. I spent 15 years in San Diego, California, where I was able to see community in a different way. And it helped me want to be more involved. When I chose to move back home almost 5 years ago, I wanted to give back to my community because health is so very important, and wellness and support and advocacy. And that's what I really wanted to do. My passion has always been helping people.
And you've been a blessing to this community and also to this administration. A lot of the things that go on each and every day that we have to deal with, and usually it's a traumatic, it's like an ER room, right? You come in there for immediate treatment, and you've been doing a fantastic job navigating that. And so, but also, you've been motivated and you've been sprung into action through a level of tragedy and loss.
Yes, absolutely. When I moved back almost 5 years ago, my brother, there are 7 of us, I'll say that. My brother and I were the 2 youngest, and I'm the very youngest. He lived with me, and we had a great relationship. But at the age of 39, January 2024, he died of a heart attack. And his death really alarmed everyone that knew him because they didn't know he was sick. But it also showed me the lack of awareness we have in our families and our community. And because of his death, it motivates me to want to help men, especially with their health, and families to connect with the resources that they need so that those heart attacks can be avoidable. If he had made different life decisions and really trusted the medical professionals and really leaned on family the way he needed to, he could have survived. And so seeing his friends and his family and his children that he left behind, it's motivated me to say, what can I do as a Flint resident, as a woman, as a Christian, right, as a professional to help those around me, even if you're not connected to my family? I want you to be healthy and well.
We're going to talk more about that in our next segment as we continue Flint Strong.
If you're a Genesee County homeowner struggling to pay your property taxes, there's hope. The Homeowner Property Exemption Program helps eligible homeowners reduce their property tax burden. Thanks to Mayor Sheldon Neeley, income limits have increased to 200% of the federal poverty guidelines, allowing more Flint residents to qualify. For help with your application, contact one of the agencies on your screen or visit your local assessor's office or apply online.
Hope is here. Call today.
Welcome back to Flint Strong. We were just talking about motivation, about how we engage certain things and how we engage life to make it better. Our new division leader of health services, the health strategies and advancement inside the City of Flint is Mrs. Sheba Ward. She's been appointed to that position by me, the mayor, as one of my appointees, to be able to look at health strategies across the City of Flint and how to improve those things. We talked about our motivation about that. And you were just saying that after giving your history in Flint, being Holmes Lyons Middle School, I only say that because I went to Holmes Junior High School as well. And it kind of transitions into our next person that we've just put in contract with us, which is Dr. Gill, MD here. And let me tell you about the tie-in to Holmes Junior High School, because your father and I were homeroom mates at Holmes Junior High School. So I go back, and it's really mind-boggling that you're here as an MD, and I went in junior high school and high school. I went to school with your parents, or your father there, and introduce Dr. Gill and tell him what he's going to be doing for the city of Flint.
So once I started here, I hit the ground running. And one thing that we wanted to do was really pull in the residents and let them have a say in what's going on so we can have proper program implementation. Dr. Javon Gill and I met, and he is amazing. Though he's an MD, he has a passion and wants to really get in the community. So it just made sense to bring him on contractually with the city, and especially in this new division, so he can help us really get the data and disseminate it to residents, and then have that professional as well background as an MD to help us really drive everything forward.
Dr. Gill, not only as an MD and a Flint resident, you are a role model to many young people, especially African-American men. In this role, I thank you for coming here and deciding to be able to spend some time with us. Tell us a little bit about your vision and what you can do with us here in the city of Flint.
So my experience comes from a lot of clinical background, but living and growing up in the city of Flint. As a physician, you see one side of it. You see the outcomes of all the disparities that's going on with people, but you don't really have the time to ask all the questions or to really investigate what's going on. That's where this division, I think, is super important, because it gives the ability to go out into the community, to survey people, to try to have conversations, to be able to pull that data to see how we can make doctors and community resources better fit people and patients to have better outcomes. That's a part that we don't see too often. But it's a part that's most needed, especially in vulnerable cities like the city of Flint. If we had the resources, now we have a division that's tailored to address all of that.
Right. And when you talk about vulnerable cities and Shebra, we talk about these things. We talk about, life expectancy by zip code. Mm-hmm. We talked about a community like Fenton inside of Genesee County and the city of Flint having about a 20-year difference in life expectancy. And this is one of those diagnostics that we have to do to be able to get to the point where we are now.
Yes, correct. There's a county community health needs assessment that's done every few years, but not one specific to the city of Flint. Dr. Gill and I took that data and we took out information in order to narrow it down to Flint. And we noticed, in 48505, that life expectancy is 63 years. And all of the other zip codes in Flint is 69 years. And there is no reason, with the advancement in technology and the resources we have access to, that we should be living less than our counterparts cities. And that goes to show we're not having the focus that we need as a city. So we need to do it ourselves, because others will not come and save us. We have to save ourselves.
I grew up in a 48505 zip code. I live currently in the 48504 zip code. But definitely when you think about those data points, it's really, really mind-boggling. And Dr. Gill, in the medical profession, what is some of those deciding factors that go into this, and when we look at the data?
So it could be a lot of things. I think a lot of it is history. I grew up in a family where my grandfather really was skeptical of doctors, but my grandfather's from that older generation who was way closer to the Tuskegee experiments. I think there's a lot of black mistrust, rightfully so, amongst healthcare in general. That's why it's nice to we have more black doctors in the field now than we ever had. And I feel like being the face of that and actually going out in the community and working with people, it kind of helps to build some of that trust. I think if people trusted their providers more, knew what kind of questions to ask their providers, knew how to conduct themselves in their appointments, that we'll have better outcomes in our city. So hopefully that starts now, that over the next 50 years, we can see that number stretch from 63 closer to that 80-year-old mark that we see in like Fenton.
Well, I want to congratulate both of you guys for this new division that we started here in the city of Flint. Thank you guys for joining the team, and thank you guys for being such a wonderful partner. I want to thank all of you who watch our inaugural Flint Strong podcast. Thank you guys. Be blessed. Think positive, speak positive for the positive outcome. We are Flint Strong.